Hello, and welcome to the Essential Video Guide to Double Eyelid Surgery, presented to you by the surgeons and patient care experts of 8 West Cosmetic Surgery in Vancouver, British Columbia. Dr. Buonassisi is going to cover some essential information about double eyelid surgery, including why some people have creases and why some don't, how a natural crease behaves when the eyes are open and closed, and what this means for the new crease that Dr. Buonassisi creates surgically, what kind of creases look natural, including the inside fold and the outside fold, the different crease heights to choose from a small, medium to high crease, and how the surgery is performed, including what you can expect to experience during the surgery, and during your recovery as you plan for time off work and your normal activities. Following this video, you should be better prepared to answer these questions. Am I a candidate for surgery? Can I safely fit the surgery into my school, work, or family life? And am I choosing a surgeon that specializes in double eyelid surgery? Once you have viewed the video, there are some additional resources that I recommend you explore. In particular, you should download the complimentary Essential Guide to Double Eyelid Surgery from our website. This is a comprehensive guide that provides important information about the surgery, including how to achieve natural results through your selection of crease shape and height, and what to expect from the recovery period. Once you have seen the video and downloaded the free guide, you may be ready to book a consultation with board-certified facial plastic surgeon Dr. Thomas Buonassisi. Dr. Buonassisi is an experienced and specialized double eyelid surgery expert. He has been in practice for over 10 years and makes double eyelid surgery a large part of his focus. Dr. Buonassisi will join us now to tell you more about the details of the surgery. Hello, Dr. Buonassisi.
Hello, and thank you for joining us. I'm Dr. Thomas Buonassisi. I'm a board-certified facial plastic surgeon. In this essential video guide, I'll be talking to you about double eyelid surgery, how it's performed, what the recovery is like, and why it is such a popular procedure. Let's start off with a review of eyelid terminology. The type of eyelid features that we're born with are passed down to us from our parents. Roughly 50% of Asian people are born with what we refer to as a double eyelid. This kind of eyelid is characterized by a small crease that separates the upper eyelid into two segments. The creases indicated in the photo on the left run from the inside corner of the eye to the outside. With this kind of eyelid, the muscle that elevates the eyelid, called the levator, is naturally attached to the overlying skin. This causes a crease to form when the muscle pulls the eyes open. The other 50% of Asian people inherit a single eyelid. In the photo on the right, you can see that there is no crease separating the upper eyelid into two segments. In this case, the levator muscle is not attached to the overlying skin and does not form a crease as it pulls the lid open. Both types of creases are variations of normal, attractive, and simply occur randomly. No one type of crease is better than the other. Since having a double or single eyelid occurs randomly, it's quite common in a family for one sibling to have creases while the other does not. People with single eyelids often complain that their eyes look small or heavy. Many of our patients request double eyelid surgery so that their eyes can look more like one of their other family members. So what are the objectives when it comes to double eyelid surgery? They really are to create a natural looking upper eyelid crease, create more open appearing eyes, create more exposed upper eyelashes, and reduced upper eyelid puffiness in some patients. Are you a candidate for this surgery? You may be. If you were born with single eyelid creases and desire a more open-eyed appearance, in this case I can create a totally new crease in the desired height and shape. You're also a candidate if you have no creases and your eyes look puffy and heavy. Some patients have extra skin and fat in the upper eyelids and they wish to have this removed during the double eyelid procedure. If this is the case, I can remove skin and fat to create a more sculpted and less puffy appearance and create a new double eyelid crease. You're also a candidate if you already have creases, but they're hard to see, or they disappear when you're tired. In this case, I can make the creases more prominent or remove skin and fat to create more open-eyed and less puffy appearance. Let's take a look at two commonly performed double eyelid surgery techniques. These are the incisional, which is permanent technique, and the suture technique. What is the difference between these two techniques? With the incisional technique, the crease is permanent. The crease is created by permanently attaching the eyelid to the muscle underneath. The crease behaves naturally, and I'll explain this in a moment. With the suture technique, the crease may be temporary. The crease is created by sutures that stay in the eyelid skin. The crease does not behave naturally. This is what I mean by a natural crease behavior. In people who are born with upper eyelid creases, the crease should be visible when the eyelid is open, as you can see here. The creases should disappear, however, when the eyelids are closed, and you can see this here. These pictures are an example of a naturally behaving crease. With the incisional technique, the creases behave naturally because the underlying muscle is attached directly to the skin as it occurs naturally. With the suture technique, the crease is formed by attaching the skin through stitches that remain within the skin. These creases are still visible when the eyelid is closed. So while there are pros and cons to both, the incisional technique produces the most natural results. While achieving natural results is often the main objective, it is important to understand that there are pros and cons to each technique. Let's look at these pros and cons when it comes to the incisional technique. The main pro is that the new crease is permanent. Because as surgeons we create the crease through an incision, there is more control and precision with creating the crease height and shape, and this allows access to the other eyelid structures to better address upper eyelid fat deposits, excess muscle, and extra upper eyelid skin. The main cons to the technique is that it is quite complex and requires special expertise and skill. Healing time is slightly longer than that of the suture technique. Let's talk more about the double eyelid surgery goals. As mentioned, it's very important to achieve natural looking results, and this is largely determined by crease height and shape that the patient and I agree upon. During the consultation, the patient and I discuss various options for crease height and shape. These decisions determine how dramatic or subtle the change to the eyes will be. First of all, the patient chooses their new crease shape. They can choose between an inside fold or an outside fold. With an inside fold, the crease runs parallel to the lash line and tapers inside the epicanthal fold on the inside corner of the eye. As you can see with the drawing of the eyelid on the left, the crease appears to start at the inside corner of the eye. Among Asians who are born with creases, the inside fold is the most commonly occurring shape. Because of this, the inside fold is the most popular choice among my patients who want the most natural looking results. With an outside fold, the crease runs parallel to the lash line and ends above the epicanthal fold at the inside corner of the eye. As you can see with the drawing of the eyelid on the left, the crease appears to start above the inside corner of the eye. Because this type of fold occurs less often in Asian people, it is less natural looking. Having said this, patients do sometimes select this fold shape since it can create a more open-eyed appearance. Once the patient has selected a crease shape, it's time to select a height. There are 3 crease heights to choose from. With a small crease height, the crease is created roughly 6 to 8 millimeters above the eyelash line, and a minimal amount of skin above this line is removed. With the medium crease, the crease is created roughly 7 to 9 millimeters above the eyelash line, and a moderate amount of skin above is removed. With the high crease, the crease is created 8 to 10 millimeters above the eyelash line, and a significant amount of skin above is removed. The small crease is the most naturally occurring crease height among Asian people who are born with creases, and is therefore the most natural looking when created surgically. The small crease height is the most popular crease height selected. The medium crease height occurs less commonly among Asian people, and therefore this crease looks less natural when created surgically. Having said that, this crease height does result in a more open-eyed appearance with a prominent, obvious crease and is sometimes requested. High creases do not occur naturally in Asians and is therefore a very uncommon request. Now that we've discussed potential candidates for surgery and some of the decisions that patients make beforehand, I'd like to tell you more about what you can expect from our staff and from the surgery itself should you decide to have double eyelid surgery. You will spend time both over the phone and in person with a dedicated patient care coordinator who's here to ensure you have all the information you need for a satisfying experience. You'll be provided with detailed instruction for preparing and recovering from surgery so that you can arrange for the appropriate time off work and other activities. When it comes to the surgery itself, you can plan to go home the same day as surgery. It takes roughly 1.5 to 2 hours to perform, and many patients relax or even doze off during the procedure. After it's complete, the patient rests for about 30 minutes and then can return home. I begin the procedure by injecting local anesthetic into the eyelids so that no discomfort is felt. Patients have the option of taking a mild oral sedative so that they're relaxed during the procedure. I then make an incision in the eyelid. I'm careful to hide the incision in the new crease so that the scar will be very difficult to see. Some patients have extra skin and fat in the upper eyelids and they wish to have this removed during the procedure. Finally, I create the new permanent crease by using a special suturing technique to permanently attach the skin to the underlying muscle that creates the fold. The sutures are removed 1 week after surgery. Most people take 1 week off work and feel comfortable being seen in public 1 to 2 weeks following surgery. How soon you are ready to make your debut really depends on the degree of swelling and bruising that you experience. Everyone heals differently. You'll be fine to be back to household activities the day after surgery, light exercise after 1 week, and vigorous exercise 2 weeks later. While you'll see the results of surgery in the first week, the complete result can take up to 6 months. Most patients experience little to no discomfort during the recovery period, but are sometimes bothered by itchy eyes where the incisions were placed. The majority of bruising and swelling is typically gone in 1 to 2 weeks. However, some residual swelling can last for 3 months. Your new creases will appear too high in the beginning because of swelling. This will then settle to its final position over a period of several months. We'd like to keep in touch and see you on a regular basis to monitor your progress. A typical follow-up schedule consists of aftercare appointments 7 days, 3 months, 6 months, and a year after surgery. Thank you for joining us. If you have questions or would like to book a consultation, please call our office at 604-733-1669 or visit us at our website at 8west.ca. We're here to help and looking forward to assisting you.